Hello everyone, Professor D here. This week we're going to talk about addictions, alcohol, and chemical dependencies. Addictive behaviors can affect anybody. They do not discriminate against socioeconomic status, religion, race, sex. The world over could be at risk of developing an addiction, so we're going to talk about that today. The definition of an addiction or dependent behavior is a behavior that people perform repeatedly that result in problems in one or more of the major aspects of their life, meaning financial. So they might be really struggling because of that addictive behavior. Relationships, it affects relationships between maybe family, loved ones, colleagues, best friends. And it can affect work. Maybe they've lost their job because they weren't showing up. And it can affect home life, or they may not be able to maintain their home appropriately. They may not be paying for the utilities, etc. So there are one or more of those major components in your life are severely disrupted by that repetitive behavior. Addictive behaviors result in someone's attempt to improperly cope with a particular emotion that's really strong for them. So an anxiety or vulnerability, a severe stress, or something along those lines, or intense anger about a situation, or their inability to control the situation. So in their attempts at coping with that, they seek out this behavior that gives them sort of a high, that endorphin, serotonin rush that we experience with certain items. And it doesn't have to be chemical. We'll talk about that very shortly. Oftentimes these people have difficulty with impulse control and or self-esteem. So they might not be able to stop that sensation from occurring. It makes them feel good about themselves because they don't hold themselves in high value at that moment in their life. And we'll talk about why that's important to understand. Certainly genetics have been proven in studies to be a basis, not the definitive reason that someone might have an addiction, because we have to realize that people also do learn behaviors from family members and friends and such as well. And it might be a different addictive behavior than someone that they know has, but they have seen that that individual has been able to cope using those methodologies. So that might increase their risks, especially if they already have a genetic predisposition. Once an individual has one addictive behavior, even if they are able to stop that addiction, another one is very likely to occur if they don't find the underlying root causes of that. Whatever that emotion was, whatever the trauma was in their past that triggered that, they need to really find that, often with the help of a professional, and work through that and develop better coping mechanisms so they don't continually seek out that endorphin rush through that addictive behavior. Some statistics that we want to know about are that about 20% of the United States suffers from an addiction, and each person with an addiction affects at least 10 other people in their lives. And they all experience pain, stress, fear, shame, guilt as well. So it might be a close friend or family member or a child if it's a parent that is experiencing these emotions because of that person's behavior, or their life has to be altered to accommodate for that person's addictive behavior. Some types of addictions and dependencies can certainly be chemical. We hear about those a lot, so with alcohol and illicit drugs, and sometimes over-the-counter drugs are misused, other people's prescriptions, things that are able to give them that chemical rush. Other things are involved more in behavior, such as gambling or addiction to pornography or addiction to sex, because of the chemical rush that the body gives you when you're performing that activity. So it's not necessarily that you're consuming a chemical, but you're heightening the chemical response in your body by performing those repetitive behaviors, and those can be challenging for individuals. You have seen in your reading and in your lecture slides that there are very many different types of views out there on addiction. Addiction is a challenging one on how to diagnose and treat because it doesn't have those numbers that you can look at, such as with diabetes. You can't measure the amount of glucose in someone's blood, so on and so forth, or their blood pressure. That has nothing really related to do with addiction. So over the years it's morphed, and there's different varying views out there on what addiction is and can it be treated. So definitely look at those as you're doing your reading and going through the lecture notes. In more of a wellness perspective, you want to look at it as a whole human being. There's a reason they're having that behavior. Can they go back and figure out what that reason is and then work at coping with that? And also, can they find ways of decreasing stress in their life? Meditating, yoga, the other things that we talked about in the past. Can they incorporate that to improve not only physical body, but their mind and spirit as well? And that's really important. And that's in those instances where people often don't look at the root cause and look to improve the other 8 dimensions of wellness and their mind and spirit, they often relapse or they go back to those behaviors or develop another addictive behavior or repetitive dependency because they have not been able to go back to that holism and create a wellness paradigm for themselves. So that's really important. So looking at why and coming to terms with past traumas and anger and anxiety in the life is important for that individual, and it's not always a pleasant journey. Sometimes going back and facing those emotions head on can be very scary, and that's where a professional definitely needs to come into play. Also, finding forgiveness in themselves and in others. If they feel that there was another individual or circumstance that occurred to create the original trauma that caused this dependency, this addiction, then it's important to look into that and maybe, if they can, offer forgiveness eventually. And that's definitely not something that's going to happen overnight. It's a long process and a difficult journey for them. A few terms I want to talk about in relation to addictions and dependent behaviors are tolerance. Tolerance means that someone's getting so used to that particular chemical substance or a certain amount of gambling that it's not giving them that endorphin rush, that high that they're looking for. So they need to do more of it or find more risk-taking behaviors or start combining different chemicals to get that same response. And that can certainly increase the chances of there being an overdose or getting injured because of that risk-taking behavior. Dependence means their body has become to accept that as required at a daily level, and that their cells are really looking for that chemical or that endorphin rush. So they start to feel that they have to do this to continue, even though physiologically their body really doesn't need cocaine or doesn't need to have the endorphin rush from gambling. Their body has rewired itself to feel that it does. And that can be really challenging to stop, because if they do stop cold turkey, as we say, meaning just boom, I'm not going to do it anymore, they start to have what we call withdrawal symptoms. And that means they have stopped whatever that behavior is, and their body is saying, hey, where is that endorphin rush? Where is that chemical? I'm looking for that right now. And they start to be restless, agitated, irritated, just feel achy. Sometimes they hallucinate, they get the shakes. They can't sleep very well. They're kind of this full body ache. They're just not comfortable because their body is looking for something that it has grown dependent upon. And oftentimes it can last 2 days to a week, and they will often potentially relapse during that time if they don't have the proper support and guidance and plan in place and new coping mechanisms, because it's when they realize that, well, I can just go back to the behavior and this will all go away, the pain will go away, it increases the likelihood of relapse. So we want to make sure we understand the terms tolerance, dependence, and withdrawal in relation to addictive and dependent behaviors. I hope you found this video helpful, and that it really showed you the challenges that go along with addictive behavior and dependent behaviors, and that they can happen really to anyone. Anybody's really at risk. Certainly some are more at risk than others. And additionally, we want to understand how challenging it can be to change or stop that behavior. Your Health Behavior Modification Project gives you some insight into that, because some of you will have some struggles with just being able to increase the amount of vegetables in your daily life or decreasing the amount of sugary drinks. So imagine if there was a chemical dependence on that, because it was a chemical substance or alcohol that your body was looking for, or your body was looking for that endorphin rush from performing that activity. How much more challenging that can be. Oftentimes, outside looking in at addictive behaviors, people will just say, why don't I just stop? It's not that simple. It really isn't. And we've discussed that in the lecture series and in the reading as well as in this video. And I want you to really have an appreciation for that, which is one of the reasons why I have you do the Health Behavior Modification Project, so you can appreciate how challenging it is to alter our daily behavior. Again, have a great week.